Welcome back. Today we're going to talk about a strange disappearance of not one, but two people who simply disappeared out of a hospital. And if you're into strange history and mystery, don't forget to follow in because that's what we do here. So there are certain areas that we're just not supposed to go to. And in 2015, there is a hospital in South Africa, and like hospitals, it has areas where we can go, and in certain areas we're just not supposed to go, whether we be the patients or even the staff. So this guy shows up and he's having a stomach surgery that morning, and he's been on the list for a while. He's ready to go. And so they start the procedure and everything goes well. He's back in his room and he's got big incisions on his stomach. He's not able to move around a lot because they cut open quite a bit. The procedure went well and everything was great. Even his family came to see how he was doing. Then the next morning, the nurse comes in and she's like, I'm going to change your linen so you're more comfortable in your bed. And he's like, okay. And he's coherent. He's talking to her. She goes out to the hallway to grab his fresh linen and then walks back into his room. And when she walked back into his room, he wasn't in his bed. And she was like, okay, well, that's a little strange. I was just talking to him. But then she looked over and saw the door was shut. So thought, well, maybe he's in the restroom. So a few minutes go by and she doesn't hear anything. So she's like, well, I'm going to knock and just make sure he's okay, just in case. As a nurse, that is her job. If something were to go wrong, she is right there for that reason. So she starts knocking on the door, can't hear anybody, can't hear anything. There's no anybody saying, I'll be right out, nothing like that. So she knocks again and she's like, I'm coming in. And she turns the door handle thinking it would be locked. Nope, it was open. So she pulls it open to walk in there to see if he needs any assistance. And he's not in there either. So she goes out and starts telling some other staff, I can't find this person in this room. And they keep it pretty hush for a while. They're looking for him, but they don't want to startle anybody else that is a patient there. So they're wandering around, they're looking for him, and they can't find him. And the day goes by. And the next day, they're still looking for him, and he still hasn't shown back up. Now, how does somebody just get up and walk away while they have huge incisions in their stomach? And most people can't easily just walk in and out of a hospital without other people not seeing them. So 2 days go by and they finally decide, we're going to contact the family and see if maybe they have seen them. So they call the family and they're like, hey, does he happen to be at your house? And they're like, no, he should be with you. What do you mean? Where is he? So now the family's freaking out. The hospital staff's freaking out because they still can't find their patient. And the family's now concerned, where did our dad go? So now the family comes to the hospital. They're helping look too, because how does their dad just go missing? In his bed 1 minute, gone the next. So they're looking all over. They're even looking around the area of the hospital in certain houses, in lighted areas. I'm looking anywhere. They have no idea where he would have gone. So they still cannot find him. And 15 days go by. And they're still looking for him. They still don't know where he is. But 15 days later, they have some construction people come to the hospital having to do some maintenance work. And what the construction person found is mind-boggling. So this construction worker has to go up into the ceiling of the hospital. It's like an attic in a house, but you can stand up there. There's electrical. So he goes up there and he's just shining his light looking for what he needs to find. And what he sees in the corner is so astonishing. He found the patient that had been missing for 15 days. He was sitting up in the ceiling area, propped up against his side, and unfortunately, he was not alive. When they found his body, the family did a quick autopsy, and they found out that he did not die from his wounds from the surgery that was performed at this hospital. How he got up there, how he passed away, that is not public knowledge. To this day, nobody knows. Everybody has lots of speculation. Let me know in the comments what you think it is. Some people think it was even teleportation. Some people think he was unalived and pulled up there. There are so many stories that people have thought happened to this man. And then in 2019, this happened again in South Africa. So in May of 2019, there is a man that goes to the hospital because he had fallen. He was a construction worker and he broke his femur. Your femur is right here, the biggest bone of your thigh. If you break it, you cannot walk on it. It is very painful. So he walks into this hospital with lots of help because he's in a lot of pain. He gets into the hospital and they start looking at him and they're taking care of him, and the procedure goes well. And the next day he's looking at like occupational things went great. And just like the first story, a nurse goes in to check on him and he's simply gone. He's out of his bed, He cannot walk on both legs, but somehow he walked out of his room. And this hospital that he was at is very, very security. So they didn't hold back. They immediately contacted the family, got lots and lots of security around to go look around the area, try and find where he went. They were not hush-hush, the first story was. 6 days later, they still have not found this man, and they still cannot believe that he would just simply walk out of this hospital. It was very high security, and he had a broken leg. That is very hard to do. So they're wandering around the hospital, continuing to know that this person still is out there. They don't know where he is, but then somebody started to smell something really, really. So they followed the smell and they found a janitor's closet. They open up the janitor's door and there's some black stuff seeping from the ceiling and it has this awful smell. So one of the maintenance mans goes up and he's checking out where this smell might be coming from. And there he is, the man who had broke his femur, sitting up in the ceiling. He too had passed away. What he passed away from, they're not sure either. They did an autopsy on him also. He didn't pass away from his injuries from his broken leg. But it's not public what he passed away from. How are people just disappearing out of their rooms in hospitals? Nobody sees them. All of a sudden they're gone and they're up in the ceiling. What do you think happened? Drop in the comments. I would love to know your thoughts on this because these are very, very cases. And if you're not already, don't forget to subscribe, like, follow, that fun jazz.